Is there a critical difference between NAFLD and NASH? Imagine your liver as a busy factory. Sometimes, fat starts to build up inside the liver cells, which is called non-alcoholic fatty liver disease, or NAFLD. At this stage, the fat accumulation is there, but the liver isn't inflamed or damaged much. Most people with NAFLD feel fine and might not even notice any symptoms. It's very common, especially among people who are overweight, have type 2 diabetes or metabolic syndrome. NAFLD is considered the earliest stage of fatty liver disease and often doesn't cause serious problems right away. Now, think of what happens if that fat buildup triggers inflammation. That's when NAFLD progresses into non-alcoholic steatohepatitis, or NASH. This is a more serious stage where the liver not only has excess fat but also shows signs of inflammation and scarring, called fibrosis. The inflammation damages liver cells and can lead to more scarring over time, which makes the liver less able to do its job. NASH is dangerous because it can cause significant liver damage and increase the risk of liver cancer. The key difference between NAFLD and NASH is that NAFLD involves fat in the liver without much inflammation or scarring. NASH, on the other hand, includes inflammation and damage, making it a more aggressive disease. This difference matters because NASH increases the risk of developing liver cancer much more than NAFLD alone. Studies show that people with NAFLD are about 7 times more likely to develop liver cancer than the general population. But with NASH, the risk jumps even higher because the ongoing inflammation and scarring create an environment where cancer can develop more easily. Interestingly, liver cancer can sometimes develop in NASH patients even if they do not have cirrhosis, which is advanced scarring of the liver. This means that the inflammation itself can promote cancer development even before the liver becomes severely scarred. This is different from other liver diseases where cirrhosis is usually a prerequisite for cancer. In terms of symptoms, people with NAFLD often have normal liver enzyme levels and feel fine. But with NASH, liver enzymes tend to be higher, and the liver's function can start to decline. When it comes to diagnosis, imaging tests and liver biopsies help doctors tell whether someone has simple fat buildup or more advanced inflammation and scarring. Treatment strategies also differ. For NAFLD, lifestyle changes like losing weight, eating healthier, and increasing physical activity are usually enough to slow or stop the progression. For NASH, more intensive medical management may be needed, and in severe cases, a liver transplant might be considered. Because NASH can progress quickly and has a higher chance of leading to liver cancer, early detection and management are crucial. Age also plays a role. People who develop NAFLD at a younger age, especially before 45, tend to have a higher risk of developing cancers later on, including digestive system cancers. This highlights the importance of early lifestyle interventions to prevent progression from NAFLD to NASH and reduce long-term health risks. Understanding the difference between NAFLD and NASH helps doctors decide how closely to monitor patients and what kind of treatment might be needed. While NAFLD is often manageable with lifestyle changes, NASH requires more careful medical oversight because of its potential to cause serious liver damage and increase cancer risk. Always remember, if you're concerned about liver health, talking to a healthcare professional is the best step to get personalized advice and appropriate testing.